The doctor is in. Being a caregiver for someone with Alzheimer's, dementia, and other brain conditions can be both physically and mentally exhausting. But there are plenty of coping strategies and ways to reduce the stress of all of it. Joining us today is Dr. William Nields, the medical director for Cognitive Health Centers, Sarasota, with some important advice. Welcome to Bloom, Doctor.
Thanks for having me, Gail.
So being a health caregiver of any kind, whether you're family or a professional, can be so difficult, but especially when you're dealing with Alzheimer's and dementia. So how can we focus on what is there, not what isn't?
Well, it's a good question. There are so many unique circumstances. You know, each case, each family has different dynamics and things. But I think the general idea is that as you're watching somebody with mental cognitive decline, it's very heart-wrenching, and it can be easy to get focused on the negatives. And so I think it's really important to stay focused on the positives and make the most out of every moment and focus on the things that you do have, if that makes sense.
Yeah, you're right. That is great advice for any time you're in a difficult situation as a caregiver. But you know, a lot of us, I've been in that position with my folks before, and you want to get out there and glove up and solve the problem, but really in a lot of cases you just need to learn to manage issues.
That's very true. I think that it's really important to understand caring for someone with dementia or cognitive decline is a marathon. And a lot of people, especially at the onset, have great hope and expectations and work really hard in sort of a sprint and can get burnt out and frustrated. I think it's really important to look at it as a marathon. It's good to do due diligence and find things that help your situation, but you have to temper expectations. Especially working with the individual, it can become frustrating to watch somebody you love unable to do a simple task. Things like that. You have to be adaptable, and it's a very difficult situation.
And pacing yourself is incredibly important, because if you're not feeling good and your health is not at the right place, you're not going to be able to help others. So it's important to take time for yourself, correct?
Absolutely. That's one of the biggest factors I see in patients and families that are managing this well, is they schedule and take time for themselves. And that can bring up a lot of feelings of guilt or difficulty taking your mind off of the situation when you're away. But it is extremely important to recharge your batteries and be able to give your best then when you are with your family member.
And as you are a caregiver, you're the voice for that patient in many aspects of their care. So is there a way that we can adapt our communication styles?
That's a great point. I think each case is different, and there are different stages, and so you have to be sort of adaptable. I think as the disease progresses, you want to use simple languages, keep things cut and dry. People describe primary color discussions, yes and no, this or that, keeping things simple, not having a lot of variables, giving time for a person to respond, allowing more time.
And you say something that is very interesting to me. You say don't ignore their wants, but safeguard their interests. What exactly does that mean?
Well, when you're caring for somebody, they want to maintain independence. Most patients have that desire to be independent and do things, and I think you want to allow that as much as possible, minimize conflict, and give them as much ability to do as much as they can. However, if they're doing something that's harmful or unwise, you have to be able to step in. We've had patients trying to give away all of their money or maybe do things that aren't safe, so that you have to have the ability to step in and redirect the behavior.
Well, Doctor, I have to say, I think it's really incredible that you're giving this kind of advice, because, you know, you're a medical expert, and that goes without saying, but a lot of times the caregivers feel lost. So this has been so valuable. I really appreciate you joining us on Bloom today.
Well, thanks for having us. We really view each family, you know, when we have the family is part of the patient that we're caring for.
I can tell. I can definitely tell. Thank you, doctor. And for more information, you can visit cognitivehealthcenters.com and stick around.